Hey, it's Dr. Jeff. I am a board certified orthopedic surgeon that switched into regenerative medicine in 2009. Shortly after that, I noticed myself getting some symptoms: memory loss, hand tremors, inability to remember people's names, not even just like patients, but like family members. And I became really concerned. I knew I had something neurologic going on, but I wasn't sure what. So like many of you, I went through the gamut. I saw my family doctor and was referred to a neurologist and didn't get anywhere. And I went to see another neurologist and he thought maybe Lyme disease. And he asked me a question. He said, "You remember a tick bite?" And I didn't remember anything, but after talking to him for a while, I remembered that I was on a mission trip and I went up to scratch my head, bald head, and I felt something like a bump and I scratched it and immediately had some blood in the area. So it made me think, could that have been a tick bite? Well, over the next several weeks, my symptoms got worse. Matter of fact, to the point that I couldn't practice for about 6 months. Like many of you, I went through the entire gamut of treatment. I did doxycycline, I did azithromycin, I did Mepron for babesia, ended up with a PICC line and IV ceftriaxone. I got better. After about 6 months, I was able to get back to work. I had one of the advocates in our Lyme community reach out to me and said that, you've been through it, you're a physician. If I sent you a few patients, would you be willing to treat them, diagnose them, order the lab tests, and get them on a treatment protocol? So I did. Well, it bloomed into maybe about 10% of my practice. I was able to meet up with some of the better doctors in Lyme disease. I actually got to go out to New York City and spend a month with Dr. Dan Cameron, who was the president of ILADS at the time. I became involved with ILADS. So that's my Lyme story, but that's not the end of it. I always was curious as a physician and as a researcher, why some people will get Lyme disease, get over it, maybe in a month, maybe 2 months, maybe 6 months, but some people wouldn't get over it at all. Chronic Lyme disease. What was the difference between that patient and a regular patient? And I never really could figure out the answer. I had ideas, chronic inflammation, but it wasn't until COVID. When COVID hit, I realized that we had the same idea. We had people that had COVID, got over it in a week, 10 days, and were fine. But we had some people that had long-term COVID, or what were referred to as long-haul COVID. Those people didn't get better. Some of those people are still sick now. I was talking to a really good friend. He's a functional medicine doctor in Montgomery, Alabama. And I was talking to him about COVID. He had about 400 COVID patients, 0 hospitalizations and 0 deaths. I was amazed at what he was doing. And I found out that he was using a drug called Lamictal. Lamictal is an antipsychotic. But if you look at the pharmacology of that drug, what it does is it decreases cytokine storm in your brain. That got me thinking. So if these chronic conditions, chronic Lyme disease, long-haul COVID, are really related not to a recurrent infection or not to a long-standing infection, but the infection is over and treated, and then you get a chronic cytokine storm that blasts your system. It attacks your cells, it attacks your nerves, it can attack heart cells, it can attack joint cells, it can attack anything in the body. Then you get the chronic inflammation and your symptoms never go away. So I started looking at treatments, and there are a lot out there. Some are more expensive. If you look at things like ozone treatment or what's called EVOO, EVOO, very good at treating cytokine storm and long-term inflammation. But I found some supplements that I think work. So if you want to know more about my story and what I think is currently working, respond STORM to this video, and I will send you some information via email that might really change the way that you look at long-term Lyme disease, chronic Lyme disease, and may change your symptoms.